Forensic Anthropology Case Presentation on the Stein M. Case Report. So, here's some background information on the case. Child abuse occurs when physical or mental health and welfare of the child are harmed. This includes all forms of physical and emotional ill treatment, sexual abuse, neglect, and exploitation. When assessing children abuse, it's important to look for patterns of injuries. These injuries are often in various stages of healing. Postcranially, fractures sustained from child abuse most commonly occur in the ribcage. It can be very difficult to distinguish fractures that occur from accidents versus fractures that are caused from child abuse. Complex or multiple fractures, fractures crossing sutures, and depressed fractures are all suggestive of applied force, such as physical abuse. Skeletal injuries due to child abuse have some distinctive characteristics, including multiple localized areas of asymmetrically distributed subperiosteal bone growth in different phases of healing. And the stunting of growth and poor dental care are also common findings in child abuse cases. Alright, so as for the case itself, this is revolving a 3.5-year-old boy who died in 2004 in the Gauteng province of South Africa. He passed away due to several massive injuries, including a cranial fracture. At the time of his death, the child was in the care of his stepfather, and the stepfather had originally reported the child fell in the bath and injured himself. Later, the stepfather claimed that the child had an epileptic fit despite having no history of epilepsy, and that he hit the floor with his head. The child died before medical help could be obtained. An eyewitness who arrived at the scene after the incident had happened reported that the boy's room smelled of blood, that there were blood spatters everywhere, and that the child's mattress and pillow were wet as if someone had tried to clean it. The room, however, was only investigated by a forensic anthropologist after it had already been cleaned up. The child's autopsy found that the child had several bruises and lacerations, that the child had a blue right eye, and multiple abdominal injuries. However, no x-rays were taken at this time, and the body of the boy was buried shortly after the autopsy was completed. At the time of death, the child weighed only 10 kilograms. A year after the child's death, the prosecutor for the case decided to have the child's body exhumed to have remains assessed for signs of chronic abuse. The intentions of this were initially to charge the stepfather with the murder, but also to investigate prolonged abuse because the stepfather and the birth mother had both been accused of child neglect, ill treatment of their child, and the murder itself. So after the body was exhumed, they realized the remains were almost a complete, full juvenile skeleton. Some of the soft tissue was present. The skull, however, was in several pieces and needed to be reconstructed, but due to plastic deformation resulting from blunt force trauma, the reconstruction could not be perfectly executed. There was no attempt to determine the exact age due to the apparent appearance of it being super young, and the dental records did match a juvenile in such age range. He had a full set of deciduous teeth that had erupted, but none of the permanent teeth had yet erupted. So when analyzing the cranial remains, there were 2 unsealed perimortem fractions that were clearly visible. As for the first one, this was determined most likely the cause of death. It was a massive fracture on the left side of the skull. This originated at the skull base in the optical bone and stretched through the optical bone and the left parietal optical suture into the left parietal bone. There was also widening of several of the cranial sutures that were visible. As for the second fracture, it was present in the roof of the right orbit, and it was consistent with the evidence that the pathologist had reported that the child had a blue eye on the right side. The fracture, however, was not recorded during the original autopsy. The tooth socket of the lower lateral incisor was also fractured. There was also a small crack-like structure also evident in the left temporal bone on the pars pestrosus inside the skull. There was evidence of healing, though, suggesting that this could have been a previous cranial fracture occurring before the death. There were no other signs of previous fractures on any of the other postcranial bones. There were some small bony protrusions on areas of sun periosteel bone growth on the medial side of the right femur and the anteromedial surface of the right tibia. This may be related to a previous infection or trauma in the area. All the upper, left lower, right lower, central incisor, first and second molars of the child's teeth were present. There were also large, untreated carious lesions present on both upper and lower first molars and the left lower second molar. The child's stature and weight was plotted onto a growth chart based on entries in the post-mortem report. His stature fell within the 50th percentile. However, his weight at the time of death was below the 3rd percentile, showing that the child was extremely underweight. So as for the results of the case, there were no real conclusive evidence found. No medical records were available, so all the decisions depended on post-mortem assessments. The growth chart found by investigators did indicate that when the child was 2, before the stepfather entered the picture, the child was 13 kilograms, 3 more than he was at the time of death. Physical evidence presented to the court indicating possible long-term neglect and abuse in this case was based on 2 areas of periosteal bone growth. It was based on poor dental health, malnutrition, stunting of growth, and inconclusive evidence of a possible cranial base fracture. So as for this possible cranial base fracture, the jury seemed that it was unlikely that such major injury could occur without proper intensive care, and there were no such hospital records to prove that injury. They also determined that such fractures are relatively frequent in children with head trauma. And this suspected fracture was transverse in nature, meaning it would have resulted in deafness, and there was no medical or daycare records available to prove that the child did have deafness. There was no conclusive evidence because of this that previously cranial injuries could be presented in court, so the stepfather was found guilty of murder but not of the chronic abuse. However, the pathologist did state that the fracture that was most likely the cause of death would have required a major force. This could have been swinging of the child by the leg and hitting the head against a solid object. For the murder, the stepfather was sentenced to 15 years. However, the birth mother was not found guilty as she was not home during the incident, and the court deemed all evidence of chronic abuse inconclusive. So what we can learn from this case is that the children's bones are quick to remodel and signs of previous trauma can be extremely subtle. When these signs are more subtle and inconclusive signs of trauma are the only evidence to present, it can be more difficult to convince a court that chronic abuse was present.